confidentially, ain't she cool?
Transforming grim Victorian institutions for the poor into modern centres of medicine for all. Forbidding, rudimentary and reserved for the destitute, hospitals were a last resort. But in the decades leading up to the NHS, hospitals would undergo an extraordinary transformation. At the heart of this change was a fierce battle against death and disease, as scientists searched for miracle cures. Britain's hospitals were helpless against it. It would claim more lives than the trenches of the First World War.
The Spanish flu was pretty much global. There was almost nowhere in the world, I think some part of the Amazon, which escaped completely.
The flu had arrived in Glasgow in the spring. By the end of the year, 250,000 had perished. Across the country, hospitals couldn't cope. No national system existed. How you got into hospital and what kind of treatment you received was a lottery. Most people never even made it into hospital. But a change was taking place. With a lack of effective cures and no antibiotics at the doctor's disposal, the only chance of fighting disease was to stop the spread of infection. Most feared of all was tuberculosis. Diseases were rife in the big industrial cities, where the poor and undernourished were crammed in damp housing and where the air was polluted with filthy smog. The sanatorium, an antidote to the soot and smoke of the city. Sanatorium treatment for tuberculosis was free for workers under the National Insurance Scheme. Introduced in 1911 by David Lloyd George and the Liberal government, it was an obligatory health insurance for workers, in return for a deduction from their wages. Largest hospitals had developed out of primitive infirmaries for sick inmates of the workhouse, a Victorian institution for the poor. Each workhouse had formed its own infirmary. Their methods of treatment were rudimentary, voluntary hospitals. These flagship hospitals stood in complete contrast to the horrors of the workhouse. Providing for local workers and industry, these hospitals were at the cutting edge of medical care. Hospitals were still dependent on raising money through charitable organisations. One of the largest was the King Edward's Fund. The rise in middle-class patients gave voluntary hospitals a chance to tap into some vital new income. But a new piece of legislation in 1929 would allow local councils to take over the running of these old institutions. They became known as municipal hospitals, and London was leading the way.
On the 1st of April 1930, the London County Council appropriated all the hospitals it had inherited, both from the London workhouses and also from the Metropolitan Asylums Board. Overnight, they had on their hands 98 hospitals, which they set about trying to organise into a coherent system.
Emergency medical services was set up. So that was 2 years before the war was even declared.
In the towns, the front line of modern war, the health services were organised to deal with the menace of air attack. The voluntary and municipal hospitals were linked together under one national health service.
50,000 hospital beds were added in just a few months. The emergency medical service had set an example of how an integrated hospital system could be run.
What the Second World War did, of course, was to emphasise that health could no longer be left to philanthropy, could no longer be left to voluntary initiatives and good-hearted ladies selling flags. It was the health of the nation, and the nation or the government needed to take responsibility for it. You know, the health of the nation was too important to be left to these hodgepodge of arrangements.
The idea that citizens had a right to hospital care was crystallised by the experience of war. The First World War had ended without a proper hospital system. The Second World War would help provide one.
After the First World War, everything went back to the way it was.
The change in mood had brought a newly elected Labour government. It began immediately to implement plans for a new National Health Service. Despite huge support for a unified service, the government faced opposition from the medical profession. Key to the disagreement was the prospect of a state-salaried medical service. Some consultants were reluctant to give up their lucrative private practices and suspicious of the state undermining their independence.
It was Nye Bevan who inaugurated the National Health Service. I think once said that he'd filled the doctors' mouths with gold to persuade them to go with the new system.
Bevan's gold meant doctors could still hold on to their private practices even though they were employed by the state. The government could now push forward with the new legislation.
On July 5th, the new National Health Service starts, providing hospital and specialist services, medicines, drugs and appliances, care of the teeth and eyes.
This had been a long revolution, built on decades of innovation in which the hospital had played a central role. United in war, the hospitals had laid the foundations of a new system which for the first time in history would provide health care for all. Free at the point of service, from cradle to grave.